Hi, good evening. My name is Benjean Domalaon, and I'm here for the interview.
Hello, Ben. This is your first question. So, considering the NMBA standards for practice that governs your nursing practice, how will you deal with the following scenario? It is your first rotation as a new graduate nurse looking after a patient with COVID-19 who is in isolation. They insist on leaving the room to have a cigarette. They become agitated with you. How would you handle this situation?
Okay, so in my opinion, it doesn't matter if you are a newly graduate nurse or experienced nurse. As a nurse in general, it is our duty and responsibility to look after our patients' well-being, including their health and safety. It is our responsibility to adhere to all the nursing standards of practice to be able to provide a safe and quality healthcare to all. We also have a due responsibility to look after the welfare of the others and follow the right protocols being implemented in our workplace.
Mhm.
In this situation, our goal is to identify and mitigate the risk as much as possible.
Mhm.
I have learned all throughout the years of working in the healthcare industry that handling a patient that is verbally agitated that may cause physical harm to you or themselves require us to be more resilient, patient, empathetic, and understanding, as well as maintaining a safe but respectful physical distance when dealing with them.
Mhm.
But also building a therapeutic relationship, establishing good rapport with the patient is crucial to gain their trust. I will acknowledge the patient's request, but I will ensure that to explain to the patient their current situation, as being isolated means that they can't leave the room until they are cleared to do so. I will explain to the patient that smoking will only exacerbate their condition furthermore.
Mhm.
It is essential that we provide comprehensive care to achieve optimum care delivery, and patient education is an integral part of that. Educating the patient about possible complications of their request might enlighten them and eventually change their mind. I will try to reassure the patient and try to divert the attention into doing something else. And also, like, as nursing is a collaborative effort, and we work in a multidisciplinary team to provide holistic care to our patients. As nurses, we can try to cater to our patients' needs to be the best that we can, but sometimes we need to escalate concerns that are out of our scope of practice. From here, then, my duty now is to de-escalate the concern from for my for to my team leader and or my nursing unit manager. I will ask the patient to wait until I get my manager to decide regarding the request. As de-escalation also means that if agitation turns into physical aggression towards staff members, calling security for assistance is also an option. It is within our ethical guidelines to ensure proper documentation is attended to. I will also ensure that this incident is properly documented for evidence of trying to provide a suitable nursing intervention. There are instances where it will be very challenges for us nurses to deal with a particular issue, but the only way to handle this is to be confident with your decisions, but also be empathetic, professional, and respectful towards the others.
Mhm.
That's it.
Very nice. Your second question. Nurses must comply with work health and safety standards. Describe a conflict situation you have been involved in your undergraduate nursing practice or as a nursing student. What did you do? What was the outcome? And what would you have done differently?
So I remember I was allocated a placement at the Campbelltown Hospital in the respiratory unit, and I was buddied with this particular nurse. So I remember that it was the second week of my placement, and I have seen and remember the usual routine that the most nurses do in their shift. I was confident that I can take a patient load and help my buddy nurse with the task that we need to accomplish before our shift ends. It happened around 8 o'clock in the morning, just after medication rounds. I took this patient load, and the patient informed me that she was incontinent of urine and feces and haven't had a shower for days. She asked me if she can have at least a wash or just change her pad as she felt very dirty. I reassured my patient that her request will be attended to and explained that I just needed to get my nurse to help me with her as she is a two-step assist.
Mhm.
I went to see my body nurse and inform him about this, and he said, "Okay, ask me to get all the necessary things we needed, and he will come and help me," which I did. So I have everything prepared at the bedside table. I have the curtain around the patient to ensure I have the privacy and dignity of my patient, and inform her that my body nurse is coming soon, and we will help her. 20 minutes later, my body nurse still hasn't shown up. I went to look for him, and he told me that he was on his way for his morning tea break, and it was just 8:40 in the morning. I informed him that the patient has been waiting for half an hour to be assisted with their personal hygiene, and I promised that I'm gonna come to get you. He told me to go on my break as well, and I was like, oh, okay, it's too early, and can't we just like do the patient first? And so I felt sick in my stomach, and I felt the need to stand up for my patient. I told him that I'm not going on my break yet, as my patient has been waiting for a while, and it was too early to do so. Everyone was busy attending to their duties. I mentioned to him that he can go on his break, and I will attend to the patient's needs the best as I can. He left after that. So I did go back to the patient and explained that my body nurse went on his break, and I've asked my patient if she would allow me to assist her with her hygiene, and she agreed. So she somewhat trusted me, and the patient was bedbound, but was still capable of turning on her sites provided by assistants. I was able to finish this particular task, and the patient was very grateful to me. And she said that no one has done that to her for the last couple of days, and she was very thankful to me. So another nurse saw me, and she asked where my nurse is, and I explained what happened, and she wasn't happy about that, and she said that she would talk to my nurse in private. I know that as a student nurse, we are not allowed to do anything unsupervised, especially attending to patient that requires two self assist due to work health and safety issues, not just for the patient, but also for ourselves. But my gut was telling me at that point of time that to help that patient as much as I can, as I really felt bad for my patient. I mentioned this incident to my facilitator, and she acknowledged what I have done right, but reminded me to be mindful of the consequences that could have occurred with my action of attending to someone unsupervised. She informed me that she will inform the nursing unit manager about this, and she will explain my side of the story and report the nurse that was supposedly responsible for the patient. In the end, my body nurse was reprimanded by the NUM, and he wasn't happy at all. He started telling some of his colleagues about this, and I was just fortunate enough that most of those colleagues that he has spoken with, I've worked with them prior to working with him, and they only gave me high praises and defended me. If I could change at anything about this incident, I could probably try to convince him to assist a patient first before we go on the morning tea break. Maybe my communication at that time needed more work, and I could have at least tried to explain to him as an advocate of my patient that he could have changed his mind, and this wouldn't have escalated badly. Also, what I could have changed is also can change is that I should have considered the possible consequences of doing that task of my own. Things could have gone wrong, but I was just very confident that I could handle the situation without my nurse. One of my main goals why I love doing nursing is to try to help everyone in need, and sometimes I do overstep my boundaries just to accomplish this. I need to take a step back and reflect on these mistakes that I made and learn from it and be better in the future.
That's fantastic. Okay,
thank you.
Last question. The completion of a bachelor's degree is only the foundation of your development as a professional nurse. Ahead of you, there is a time of lifelong learning and autonomy. After obtaining employment, what is your short term within the next 6 to 1 year and long term within 2 to 5 years career plan and commitment to professional development?
Okay, although it is hard to predict what will happen in the future, I truly believe that in the next 6 months to a year, my short-term goal after obtaining my first employment as a registered nurse, I see myself still working in the same company, being a valued team member, and having experience working in different areas and gaining more knowledge and skills that will help me to become a better nurse. I have this goal in my mind that I wanted to accomplish at this time is to continue my learning to attending short-term courses like cannulation, advanced life support, and complex wound dressings, to name a few. Courses like this are beneficial to our profession. The more knowledge and skills, the more competent we become. I would also wanted to consider to do postgraduate studies, either midwifery or paramedicine, to be able to expand my horizons and qualifications. I have enjoyed my placement in recovery unit, and it has piqued my interest to work as a recovery or theater nurse. I
Mm.
would seek assistance to learn and gain more skills and knowledge so I can be confident enough to eventually apply for a position in this department. And in 5 years' time, I think my long-term goal is that I can see myself working in a bigger hospital, having all those skills and knowledge I have learned throughout the years, that have helped my build my confidence and be a competent nurse that can handle any situation thrown at me. I see myself performing tasks that require more responsibilities, like being a team leader or a supervisor, being a valued asset of the company, and continuing to learn more as the years go by. I believe that we shouldn't stop learning as changes occur on a day-to-day basis. And we need to keep up with the change that is happening around us so we can provide a better quality of nursing guided by evidence-based nursing research. I'm also interested to specialize as a clinical wound specialist, as I have enjoyed attending to wound dressings when I did my placement in the community health, whether it was a basic or a complex wound. And I can see myself doing this in the future. My passion to become a nurse has never withered and remained the same all these years. I'm self-reliant, motivated, and goal-oriented type of person. I never stop believing in myself, being a skillful, capable, and trustworthy nurse that will be able to impart a good contribution to any company that I work for. That's all.
Lovely. Thank you very much.
Thank you so much. Thank you for your time.